If you're just overall not healthy enough, you've got diabetes, heart disease, lung disease, things like that, it's just too much of a burden to have surgery be safe. Any unhealed or open wounds, you can't have a transplant if you have an open wound because that makes it of an increased risk for infection. And when we give you the immunosuppressants, we increase your risk of infection. If your BMI is over 40, or if you have a history of not following medical advice. So if we call the dialysis unit and they say, that person never shows up on time, the person cuts their treatment short, they don't take their medications, things like that. Compliance after transplant is very important with taking the medications. So we wanna see that you're setting yourself up for success by being compliant with whatever treatment plan you have now. Insufficient post-transplant caregiver, that means you have nobody. So we can't have you active on the list if you don't have anybody to help you in the first month afterwards. And then current smoking. Pretty much our policy is we don't want anybody smoking. Smoking is legal, however, the nicotine constricts the blood vessels, in addition to being bad for your lungs and your heart and everything else. But the nicotine makes the blood vessels smaller, and we don't want to put a new kidney with blood vessels into you if we're just going to constrict the blood vessels, and then the kidney won't get good blood flow, and then the kidney won't work. So if people are currently smoking, we'll ask them to quit and have been non-smoking for 6 months, and we do nicotine testing. We want you to do 3 months prior, ideally 6. And then this also includes any kind of smoking or vaping, or any other routes. We don't want you chewing tobacco either. In addition to making you at increased risk for mouth cancer, throat cancer, things like that.